Hello, we're going to chat really quick about pacing and your options if your patient needs to be paced. You have a couple of options here. Just a reminder, sometimes you don't know if your patient's going to have to be paced, so the best case scenario is just always set up for it, just in case that happens. So you have your normal set of pads that we talked about earlier. This is just, you would have these on your patient if you're going to do a cardioversion. Your patient's semi-stable. You basically just want to cardiovert them nice and quick. We go through this all the time. The patient comes back and everybody's happy. The patient goes home. The downside is if you're cardioverting your patient, they go into C-arrest, we shock them, we get them back, and now your patient's Brady. What are you going to do? So your option, if you're using these pads, is you're obviously going to have them connected. They just connect like this. Most of the time, this is how they're going to be connected to your patient. If you need to pace, you're going to have to come to the back of your machine and grab your 3 leads. So to connect your 3 leads, you're basically just going to slide it on here, nice and quickly, and then connect it up to your patient, just like you normally would. So remember, you're going to have your 3 leads from your monitor, and now you're going to add an additional 3 leads, so you're going to have 6 leads on your patient. What I recommend is if you're ever cardioverting and you're using these pads, just get in the hang of putting these on as well, just in case that ever happens. Your other option here is basically, if you don't want to use this setup, you can grab our other setup, which is what we use for we call them our CRS pads. They're the one-step CPR. They multi-function electrodes with one-step pacing. So everything is built in. Now remember, if you're pacing the patient, you want to put the pads on how they state in the picture. So just remember the picture. You can quickly throw your pads on, and then all you have to do with these pads is basically connect them like this, and you don't have to worry about anything else. So you can shock your patient. If your patient, you get Ross back and your patient goes Brady, and now you can pace your patient. So it's your option. You can use these pads in this connector, or you can use the one-step pads. These ones are kept in the trauma bay, and these other ones are going to be kept, they're actually currently stocked in the mothership, and that's the only place they should be stocked. Now to pace